Okay, good afternoon, everyone, and welcome to FHCA's webinar, Healthcare Burnout, What is it and Ways to Avoid it? I'm Kristen Knapp, Senior Director of Strategy and Communications for Florida Healthcare Association and your moderator for today. And our presenter is David Baumgartner, CEO of Tresane. Before we get started, I want to go over a few housekeeping items to help our program run smoothly for you. We want to remind you that all attendees are muted due to the large number of participants. We encourage you to use the computer audio rather than a telephone to maintain sound quality for today's presentation. And we encourage you to ask questions throughout the presentation by typing your questions into the question box. And that slide you see now shows you how to do that by submitting a question using the question box below. This webinar is being recorded and an online archive will be available to you on the FHCA website along with additional handout materials. And if you have a colleague unable to join us, please encourage them to view the recorded webinar. Today's program is brought to you by the Caregivers Florida Career Program, which is our CMS funded grant that FHCA's Education and Development Foundation is sponsoring in partnership with the state of Florida Agency for Healthcare Administration. Just a reminder, this program gives providers access to free resources that includes connections with job seekers, job postings, recruitment promotional tools, and educational webinars like today's program. Okay, and with that, we will go ahead and get started. David, we'll turn it over to you.
Excellent. Good. All right. Thank you, Kristen, and thank you, everybody. And certainly a special thanks to Caregivers Florida, the program, for sponsoring this. It's a privilege to be with you today. So today we're going to, by the end of it, we hope there are 4 points for you to consider. 2 questions to ask yourself as you go through life and go through work. We're going to talk about 1 competency at the end, and then going to give you 1 guarantee by the time the whole program is over. So at the end of the day, that's what we hope to leave with you. So just want to have a couple housekeeping items. I've been doing some of this work for a long time, and we noticed that in some of the leadership and development work that people can say they're calmer in crisis, improved communication, and so forth. But one of the data that's low is that people don't often talk about what they learn as they go through learning about themselves during difficult times. So the first thing I want to encourage you to do is, if you learn something today and a way that I can look at something different, don't just think that I'm the only one that has that problem or sees life that way. I encourage you to share anything you learn, because all people go through the same stuff and have the same ways that we block ourselves. So the first thing is share your learning always. And the second piece that I like to always chat about is be open. We're going to talk about some concepts and some theory and some practices and so forth. Rarely is there something that is brand new. And so you may hear of something and say, oh, well, that's called this, or that's called that, or whatever this might be. And so let's try not to get caught up in a phrase or a word or way something is, but think about a concept and how we apply what concept that you learn and a concept here to what you're used to. So I'm not married to words or phrases, but it's the principles that we're trying to go after. So, and again, if you have questions as we go along, just hit those in the Q&A. So, long before COVID, healthcare has been a burnout issue. And so, we've had these financial stresses and things going on, but you can see these orange to the right. Those are 3 different research papers on burnout in healthcare. So you see there's one from 15 and one from 19 and another one from 21. And so the stressors that have gone on in the workplace and healthcare specifically, COVID didn't create them. In fact, it was interesting. This morning I was at a conference and they were talking about the trend towards the gap between people leaving the workplace and new employees coming into the workplace. That big trend started in 2010. So the symptoms that were really accentuated when COVID that's been going on for a while. It just became very apparent and clear during COVID. And so what we want to talk about is, what might cause burnout. I was talking to one person, they said, "Oh, don't talk about burnout anymore. I'm just tired of hearing about it." So we could call it the B word if you want to call it the B word. But this is the world around us with which we all live in and what's going on. And we have, competing demands and patients and my peers and personal life and regulators and payers and, the organization. And then there's my team in the middle and myself is represented by that dot. So does that make sense on all those competing demands that are going on around us? That could be the way it feels, but really the way it is it looks more like this, right? We think that we are that big of a dot, but I'm this little bitty dot here in the midst of all of this stuff that's going around us. And that's where part of that burnout and stress comes from, is I feel like things are just closing in, or I'm in quicksand, or suffocating with all the stuff that's coming at us. So that's the reality with which leaders find themselves today, is all this stuff that's going on around them. And so let's do, with that as a context of all the stressors and the competing demands we have, we're going to do a quick little poll. So just answer the questions here. How optimistic are you about the future? Not excited, through eager for the future. And then we'll launch the poll when we feel like most people have answered. Whenever you're ready, you can. Will the results show up? I guess they will. Oh, there we go. Well, nobody voted. All right. Well, we will close on this then. Okay, so let's just move on then. All right. So what a lot of times folks are not horribly excited about the future when they can think about all the things that are going on around them. And there's no wonder, because there's this stuff that's happening. There's no staff in COVID, inequalities going on. We have burnout, competing demands, divisiveness, financial constraints. All these things are going on. But in the middle of all of that, there's also, we see resilience, and we see inclusion and caring and compassion and hope. So in the middle of all of that mess, we also see this stuff that goes on well. So why do we want to start here? Is because the ability to recognize the source of burnout and where that comes from gives us the ability to detach from it. And that's why we go here. And so I want to start off with our leading into our first point, is that the way we look at life is important. And so Barbara Fredrickson did some research, and her research is referred to as the broaden and build research. And what she found out is that when an event occurs, whatever that event is, it could be a survey issue, it could be a staff member calling in, it could be, something with my children, or whatever that might be. And that event occurs, and we go, oh my gosh. And then we focus in on that event, that stress, we're able to read that. Then negative emotions kick in, which create more stress. And then we have a sensation to threat that creates more narrowing of our perspective, focusing in on this event that's causing this. And you can see that it becomes a spiral inwards, and it creates a narrowing of our perspective. And so another way then that folks can do this, or what happens, is people develop the competency that when that event occurs, we go, oh my gosh, whatever that is. And we acknowledge that went on. What am I going to do about this? And then we take a minute, and whatever that minute is, and we create this state of mindfulness around the idea of recognizing what's gone on. And then we can begin, once we name that and claim that this is not a fun situation, whatever this is, and how are we going to get through whatever this might be in front of us, not necessarily just me, as we'll talk further, but how will we get through this? Then we can begin to disconnect from that. And then that creates an opportunity for broadening of the way that things are, the perspective we have. And so it's called the broaden and build theory. You can Google it, and Barbara Fredrickson. So the point of this is that the way we look at things, whatever those things are, and we acknowledge them and we disconnect from them, has a lot to do with whether our focus narrows on the problem or it broadens, if that makes sense. So if you have questions, you can certainly throw those in the Q&A and the commentary. But the first point, so remember there were going to be 4 points. The first one is pressure from competing demands is real. You can't do anything about it. It's there. So the first point is, how can I be curious about how I'm reacting to this event, whatever that might be? Chin up, eyes open, and remember to broaden and build. So the first one is a mental framework around the recognition of an event that would normally cause me to narrow my focus. So I'm going to keep moving. Any comments or questions, just let us know. That's the first point. So that's the input. Here is what the research says about really what is burnout. I've been doing this leadership and teamwork forever, and people will say that they're not a good team player, or they need more accountability, or they need whatever that might be. And accountability to what, or teamwork to what? So we throw around words, and we really know what the definition of that word is. And so we want to drive down and talk about what is burnout. And so there are 6 areas for a fit or a match between the workplace and the worker. And so those 6 areas are workload, control, reward, community, fairness, and values. And so burnout, by contrast to simple exhaustion, is when workload is combined with a mismatch in one of the other 5 areas. So let's just think about workload. Even before COVID, did we have a surplus of staff? Right? And the answer is no. Do we think we're going to all of a sudden next quarter come up with a surplus of staff? And the answer is no. So the ability to significantly reduce workload in the interim is probably slim. But the ability to become aware of those other 5 factors that create burnout is certainly things that we could see how we can get involved in that. So control, for example, think about ways that if you have whatever issue you might be facing at your facility, whatever that might be, and it may seem insurmountable. And so how do you, though, get with a group of people to think about what one thing could we do starting this week to begin to improve that, right? Even if I'm a part of a larger chain, the chain often talks about policies and procedures and ways things need to be done. But I've been in this business long enough to know that even within those types of expectations, there are ways that local leaders can adapt and create their environments. And so the ability to think about what you can control, and one of those ways to control is the way I look at things, and think about what can I control within this space that I'm in. Or I create reward. And reward in this context isn't necessarily revenue or money. We heard, I think the workforce committee, FHCA workforce committee had a person on recently that talked about the value of recognition and workforce in the place. And there's a ton of research around what that does and how do we create community within our centers in our facilities, and fairness, and understand values. So we're going to spend a little time today talking about one or two of these, but we could spend a lot of time going over each of those. So does that make sense of what burnout is? So there's a clear definition around it. It's not just this vague thing that happens to us. It's when workload is combined with one or more of the other five. Okay, I'm going to keep rolling. And so here's the challenge from a workplace perspective is the common responses to burnout are, girl, you need to take better care of yourself. You need to do some yoga. You need to become more resilient, right? And we're saying it's all on you. But the reality is that the stressors that create this are often organizational stressors, constant change, right? The industry is built with constant change. So what can we do to create some consistency and reduce that instability amongst people's staffing shortage, austerity measures that are happening within our organization because of budgets and so forth? So those things, again, are very real. And you can't do anything about the fact that we have tight budgets. Are there things within the middle of this that we can control our perspective and say, no, it's another change coming down the pipe? How can we adapt to that, right? How can we adapt to it? And so the second point that I want to make here is that the solution, one of the solutions that research suggests is the idea of team. And that if I'm a leader and I'm wearing the weight of the world on my shoulders, then that's part of the issue. So how do I begin to look at creating a small group of people with complementary skill sets? That doesn't say the same skill sets. So people who see life differently than me, we're committed to a common purpose. We have a set of performance goals, a shared approach for how they hold themselves, for which they hold themselves mutual accountability. This is the definition of a team. And so if burnout is a contributing factor, it could be the work environment. The solution to that is the team. So in other words, the second point is it's okay to recognize the world around us, how difficult it is, competing demands, all that kind of stuff, but not to dwell in that space. How do we take time to live and work together on how to solve what we can control, how we can create the environment that we need to have, how we can understand what values we need to embrace at our organization? So does that make sense? I'm going to keep moving here. So research, there's probably a dozen people around the world that have been studying teams. So we're going to spend this next bit of time diving into what is a team. So first of all, we zeroed in on the causes and some of the root causes of burnout. COVID as being a contributing factor, but clearly in healthcare, it's been going that way for a while. Like in healthcare, we've been running, red line for a long time. So COVID just accentuated it, didn't bring it on. So we spent time talking about the reality of the world around us, and then we tried to move into the idea that our perspective is what can be a contributing factor, and then defining burnout. What are the causes of burnout? And then it's not an individual issue, it's a team issue or an organizational issue. So now we want to turn the corner towards, again, defining a team. And what is a team? So there's about a dozen people around the world that have been studying teams for 40 years. And while they have different approaches and nuances towards their approach of teams, there are 6 factors that most people agree high performance teams have. And so I'm not going to go into detail on them. Some of them we'll pick on here as we go through this, but give you an overview so that you can begin to put in context around your head. How do we have this in our these are things that you can control. So the first is purpose and motivation. And we'll spend a little bit more time on this on the next slide. But do we know why we exist? We say we use things like I've been in the business forever. We said, well, yeah, we provide good care. Well, yeah, we do whatever. And again, I don't want to downplay the fact that providing good care is a bad thing, but what specifically do we do? And how do we provide good care? And is there a specific niche that we provide or a specific way? Is it more post-acute? Is it more, memory unit or whatever it is that we do? And so do we know why we exist? But there's some more nuance behind purpose and motivation in a second. We'll talk. And then external processes. So are we aware of how well we work with our external partners, our hospitals, our regional people, and how well those systems are for communicating? Relationships is the key in the middle. How well we, the 6 or 8 people that are running the nursing department here, how well we create psychological safety within our buildings, how candid we could be with each other. And so what do our relationships look like there? And then internally as a team, how well do we continue to improve the way we work together and talk about how we process, improve, and drive quality on that type of area? And then one area that we don't often hear about is learning. How well do we learn together? So if we're on a team together, how would I say, hey, Kelly, how do you like being a part of this team? What are you learning being a part of this team? What do we learn as a team, the way we work together? And taking the time once a month, once a week, to have a discussion about how well we work as a team. Because it's that learning in our dealing with these issues that is critical. And then underpinning all of this is the role of the leader. And it's not the leader's job in this context to have or be the answer. The leader's role is to create that environment where these other things happen. I get it, we're busy, but this is where that we can take a little bit of control over the world around us and talk about how well we do in each of these buckets. And I've seen it, it does not take long, especially once you get into a groove and you create this environment where that we're used to talking. And so this is by David Clutterbuck. Peter Hawkins has done a lot of work in this area. There's a decent amount of people in these the buckets and that create a great team. So it's not, let's have good teamwork. What are the components of good teamwork and high performance teams? So I'm going to keep moving unless there's any Q&As. We have an assessment available that helps teams look at this. So there's a very simple little 30-question survey that you can do that you can look at where you stand in each of these areas. All right. So if we're coming from that overarching view of what is a team, Ruth Wagaman's Harvard professor, and another one that has been studying teams forever, she talks about 4 team models. And so when you talk about knowing our purpose and motivation, then you can use Ruth Wagaman's work to get into that one corner of that slide where it says, why do we exist and what's our purpose? And there would be other slides that I can go into for all of this, but we're going to hit the high points of each of these 4 models. And they go from simple to complex. So simple is an information sharing team, and then consultative, then coordinating decisions. So an information sharing team, you think about your morning meetings, and are your morning meetings or conversations with regional folks or whatever those might be, we're sharing information up and down the line so that I know what's coming so that I can effectively do my job. And up the line knows here's what's happening down here, so we might need to pump the brakes on this. But it's all we're doing. An information sharing team doesn't make or do anything together. Their sole purpose is sharing information. The consultative team would be a team that is just gives, supports and gives advice and counsel to somebody else. So how this might normally look is that you would have a CEO or an administrator or a director of nursing that might say, I have a decision I have to make. It's my responsibility to make the decision. Now, they won't use these words, but in context and theory, this is what they're saying to the group. I have to make this decision. It's an important decision. I don't want to get blindsided. And so I would like you, my team, to debate it as if it were your decision, because I want to hear different perspectives. So I'm not caught off guard, missing something that I shouldn't miss. Now, it's not the team's responsibility to make the decision. It's the leader's job to make the decision, and they made that clear. But it's a way to say, this is why we exist and why we're on the telephone right now, is to consult with each other. This model is often used with a leader asking their team to do it. But in organizations, it's not often used where the peers can use it. Because I think as a peer, I have to have the answer, and it's my responsibility to have the answers. Instead of creating this space where that I would say to my unit manager on the other side, I have a decision I have to make, or I have a problem I have to solve, or I have this I need to do, whatever that might be. And I would like to hear your opinion of how you would do this. But it's my decision, and I will make that decision. And so it's given this freedom of space to talk through things without feeling like I'm wrong for asking for somebody's candid opinion. A coordinating team is simply, as you could imagine here, we have a new system we're putting in place, a new process, an admission from A to Z. We have an admission coming in, do we have all the things ready to go, or whatever that process is. But in a coordinating team and a decision-making team, personalities and the way we work together become more important, because we have to be able to work together in order to have a result at the end. And then a decision-making team might be, we've been talking back and forth about how we're going to approach ABC. Today, we're not leaving until we make a decision. And so where this plays out, think about when you've been in meetings and you're thinking to yourself, this meeting has, do we know why we're here? It seems like we're just rambling, right? Or people are just like, when really somebody needs to get something off of their chest. And so the ability to be aware of what needs to happen in a team environment and to set the context of the meeting when we get started is how Ruth Wagaman's work can really help out, because it can help you be clear. Hey, I need to get something off my chest. I want to hear you guys debate it and help me think through this. Or we need to make a decision on ABC. And so all the teams are legitimate, and you can have 5 or 6 people on a team. And today and right now, we're playing the role of a consultant, and later on, we're playing the role of a decision-making team. But the ability to get clear on why we're together at the time that we're together is the point of Ruth's work. So I'm going to move on, assuming there's no questions. So again, a team. The hypothesis and the proposal that I'm sending to you today is that thinking about team is the way to deal with the burnout issue. And so the team is a small group of people with complementary skills who are committed to a common purpose, set of performance goals, and a shared approach for which they hold themselves mutually accountable. In other words, it's not on a leader or a unit manager to wear the weight of the world. How do I create that environment of a small group of people where that we are working together to make this happen, whatever that might be? So we didn't get, let's just pass on the poll idea because we didn't get any from the first one, and we'll just move on. So I want to, in this one, talk about the difference between a team and a work group, because we could work together and we could, get along and have good and that type of thing. And so we can be a department like a nursing department, housekeeping department, social services, and so forth like that. And we work well together and we get along well together, but we are rowing down the stream in our own individual boats. in our own things, or I can be an individual contributor, a director of nursing and a unit manager and another unit manager, and we get along well together and we do our thing together. But do we focus together on what one or two key KPIs are important to us as a team? And that's where you define a team versus a work group, is that we know this is the focus that we have, and we're going to do this together, holding each other accountable to accomplishing these KPIs or these 3 or 4 results that are important to us. Now, we still have our day jobs, right? So different departments still have their things that they need to do as their departments, but these are the key metrics that we are going to get together and work towards. And that's the difference between team and work group. So why teams today? And this is, the answer. You've got competing demands from all over the place. And we are these little small groups right here with all of these forces coming at us around us. And so that's what it looks like today. And this is what it looks like tomorrow or next quarter. And this is what it looks like next year. So it's always changing. And so the ability to not have to wear that weight on yourself, but to have that small group, the definition of a team, where that we understand the world and how do we adapt and support each other through those changes and through those things, so that we can continue to focus on our KPIs and do our KPIs change. Because the world is going to continue to change with these competing demands all around us. But that's the way it is. So where most researchers agree is that the team needs to know their purpose. The right people need to be on the bus, not just because they're my friends or they're in a specific department. Are they bringing a competing or complementary skill set to the table that sometimes might ruffle my feathers? They need to focus on the structure, what we do together, the task and the processes, and they need to focus on the dynamics, how we work together. That creates safe space. And then they need to take time to learn and improve. And of this, it's the manager or the leader's job to manage the framework. That's what the leader's role is, not necessarily to have the answers. That's how you begin to be able to lift your head up in the middle of all the competing demands towards focusing on what your role is. So the third point is that there are different team models. What's going on in the organization? What event is happening? What do we have to deal with right now? So we're going to be a consultative team, or we're going to be a coordinating team, and to be clear on why we are on the phone, or why we're in this meeting, or why we're doing whatever it is that we're doing. On, hey, we're going to spend 20 minutes doing blah, 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 blah. Or our whole purpose here is information sharing. If we need to debate or talk about it, we can schedule other time. The role, this third point, is that there are different team models. The more clear we are on why we are together, the more focused we be and work through the differences. Okay, I'm going to keep moving. So I don't know why I just love this slide. And so we're going to begin to shift on the leader. So we started with the world around us. We started with the idea that the team is a solution. What is burnout? We defined burnout. And that the team is a great solution organizationally to deal with that. And that's where we spent the last few minutes. Now we're going to talk about what do I, as a leader, bring to the table? How do I navigate this? And so the first thing is to realize that we perturb each other. You might think, David, are you on crack? What are you up to here, buddy? And so you think about this, is we are observers. All of us are observers. It's not the circumstance that determines our response, it's the structure of our nervous systems. And so, in other words, we have values, and there are things that I value in life. And many of us don't know what our core values are and why somebody irritates us, someone or something irritates us. And so that's what happens is that somebody, if I didn't fill out a form, you could say, hey, Dave, come on, man. You know the policy, we got to have the form filled out. And I go, oh, my fault, forgot it. I'll do it. And then, if I'm doing something that's irritating you and you can't quite put your finger on it, the odds are I'm stepping on one of your values and the way you see life. And so the goal is to get into and really curious about yourself. Why does someone or something irritate me? Why do I like this person versus another person? And normally those are going to be value alignment. And so just being aware of the fact how our nervous systems work is it's just this way that we are either aligned or bugged by somebody. And the reality is the nervous system has plasticity. So whenever I get aware of why someone irritates me and realize that that's just the way I see life, then we can begin to readapt that. So I don't know why I like that slide, but I do. So awareness is the key. And so our ability to become really curious about our language and our perspective and our emotions, right? Why or how I react to something, and physiologically what happens. So Eastern cultures do a much better job than Western cultures recognizing physiologically something that's going on. But if I can recognize when, the body's talking to you before the brain registers it. If I could recognize the blood going up in my head or a knot in my stomach or a lump in my throat, and I can begin to read that, I can get more curious about myself than by the time I've recognized the fact that I'm irritated about something. And so the factors to focus on is our language and perspective, our emotions, and the body. And the whole point of this is you're a human being. You can't stop being a human being. The very best that we can do is begin to recognize it and then get mindfulness around how we're going to handle it. Okay? Going to keep moving unless there's something. So let's do a quick little values test here. At your seats or wherever you are. This is a list of, I think it's 48 words. And see if you can pick 2 or 3 words that are who you are. Not who you are necessarily at work, but who you might be as a spouse or a significant other or a parent or a child. Right? Again, we have a fun little values assessment that you can do if you want to go deeper on this. It's a fun way to go, but I just want to get the point here. So I'm going to take one of these, for example. Let's take positive attitude. So if I'm a positive attitude, or you could say a glass is half full kind of person, you think about how a person who is a glass is half empty rubs you, right? It just probably gets all over you. If it's somebody who is a solution focused kind of person who can see a problem and say, oh, there's got to be a way to work through this, but somebody, the other side of a solution focused person might be somebody who is, we've always done it this way, we can't do anything different, right? And so thinking about what motivates you and what gets you going. And then so your homework for the next 2 weeks is to look for times that people or events frustrate you. And think, I wonder what value they're stepping on. And how important is that? Because you as a leader, once you can begin to see that for yourself, then you can begin to set expectations for the team. And even better yet, where you go from that is if you're recruiting a new nurse and you've got a nurse coming in, you have 60 minutes allotted for an interview or whatever that might be, spend 20 minutes to find out if the nurse has the skills to be a nurse. Then you can use questions like, what might one of your peers do that would get you irritated? Or, what would somebody do that you would think that a good job on that? And so you can use questions to try to understand a person's value. How do I know if something I do irritates you? How would I know if somebody else irritated you? How quick do you get over these types of things? And the point there is you're using questions to infer where somebody's value is. Do it with one of your peers. If you notice a grimace on somebody's face in the morning, tomorrow morning, or your closing meeting this afternoon, look at their face and ask a question. Say, I noticed that bothered you, or whatever however you're going to say it in your own words. What is it? And then you ask them the question, and you can say, oh, it sounds like commitment is important to you, right? And when you can get to the heart of your values and the values of those 6 or 8 people that are next to you, and how we create common values for our team expectations, that's where values begin to create team and alignment and future. Okay. Any questions? I guess we're going to keep rolling. So, what's the role of the leader? The role of the leader is not to have answers. The role of the leader is to, now I'm not saying to have an answer. That's not my point here. It's not your job to wear the weight of the world and have every shoulder, every answer, right? They need to get the right people on the team and be intentional of the types of talent and people that complement what we need. How do we clarify the role of the leaders to clarify why we're here and why we exist? The role of the leader is to create the conditions for team effectiveness. It's your job to think about those components, and do we have those in place, and what are we missing, and how do we find out? And then create a sound structure, both for internal and external processes. And then to provide team coaching and learning. External coaches are good, but the ultimate goal is for a leader to be able to, when somebody comes up and asks a question and says, hey, how do we got this problem, to say, well, what would you do about it? How would you handle it? Right? You're beginning to coach those people in how to think, instead of coming to you expecting you to be their answer. So that's the role of a leader in this context, is to grow others and to grow a team. So the fourth point is that the leader is the conductor. What does the organization need? How can we be intentional and clear over what we need? All right, let's tie a bow on the day. Leadership is hard. We say, hey, you need to be accountable. Well, accountable for what? What does it look like? We have the balance by individual performance and team performance. And so leadership, you get competing demands all over. So the first thing is to remember, broaden and build. The perspective by which I look at the problem in front of me will help me, whether I can help me narrow on the problem or chin up, chest out, looking broadly on how we can go past it. The second point is that working as a team, we can begin to deal with those other 5 areas of burnout, right? You can deal with control, you can create the values of the team, you can create community, you can create reward systems. And so if you can't deal with staffing and magically have more nurses and CNAs appear in the world, how do you deal with the other 5 to create that fit in the match through a team environment? I'm not saying that the leader needs to wear the weight of that on themselves. So, 2 questions. So the first, we had those 4 points we went over, and then there's 2 questions I want you to start asking yourself, starting this afternoon or tomorrow. Why are we here? Teams can run the business and transform at the same time. So what is needed and why? And ask yourself, why are we here? Are we here for information sharing, consulting, coordinating, decision-making? And to be clear on that, when you're in a meeting and things feel like they're, not like, this is either too confusing. So are we in too much of a consultative approach, just talking about stuff? Or are we just sharing information without solving problems or making decisions when we need to make decisions? So being clear on why we exist and what needs to happen now is the first thing. So there's a first question to ask yourself, why are we here? And then the second question to ask yourself is, What value is at play right here? So the leader's role is to demonstrate leadership as the conductor and to provide purpose and structure and context for success. But ask yourself, why does this person or event align or conflict? When you could start with you and being curious about why an emotion shows up or the physiological reaction that happens on something, you can get curious about that. You can take that very same learning and begin to apply it to your teammate next to you. And that's how you create team. And then it's your team's job to take that onto the facility. So, yes, yeah. So the better question was that teams can be fluid for certain. So in other words, we could have a team of 4 or 5, 6 people, and we are coming together on this, and we're clear, hey, let's get a meeting, we have to make a decision on XYZ, or let's have a conversation, some regular cadence where we share information up and down about what's going on in the organization. So the same 4 or 5 people can play different roles, or you can have people that are part of one team and part of another team. But the point that you as a leader, the point of your leadership is to know the 6 types, the 6 things that affect a team, right? Why are we here? External processes, relationships, internal processes, learning, and then the leadership's role in all of that. Knowing how those building blocks are made, and then the type of team we need to be, whether we're information sharing, coordinating, consultative, or decision making. Hope that answers. So, and then I said one competency. We talked about 4 points to remember, 2 questions to ask, and 1 competency. And so the competency is curiosity. Think of curiosity as a competency. Why does this person or event align or conflict? What's going on with my colleague or peer? Can you ask questions to infer their values? What's going on in the organization? Are we in growth or retraction? Do we have a special project we're working on? That helps you to understand what type of team needs to be done. And then the functions that need to be filled. Do we need to share information, consult, coordinate, decision make? And so the question or the competency is not the competency of having answers, but the competence of curiosity and building those people around you. So with 4 things to remember, 2 questions to ask yourself, and 1 competency to build. So the hard truth about life is staffing shortages aren't going away anytime soon. There was a Becker's article in February of this year. I could get you the link to the article. It's a great article, and it goes down to that challenge that's going on. But it highlighted like Duke Medical Center and another hospital on the West Coast. They began to take team approaches in order to start changing their environment, to creating quality, focusing on quality. So Kelly's on this call, so we're co-presenting at the FHCA later on, and we're going to do a combination presentation on quality, how leadership and team development drives quality. And this article highlighted what that is all about. I like this picture because it's I live in Lexington, Kentucky. I was at a meeting in Louisville, Kentucky at one time, and I was talking to a colleague, came up behind me and said, hey, we started talking. I said, well, what are you doing? She said, well, I'm going to Florida. There's a hurricane coming in. And so those 2 pictures over here, the ladies around the pole and the ones holding hands here. I said, oh yeah, what's going on? That was Dorian. I think it was Dorian and 17. And I said, do you need help? And she said, well, sure. So I was supposed to go home that night, and I called my wife and say, hey, honey, FYI, I'm not coming home. I'm going to Florida. And the wife says, what? You know what's going on in Florida? So I got down to Florida about a week in advance of Dorian as we began this evacuation process, right? So that was my first experience with teamwork, right? when you do an evacuation and you go from the West Coast and you take all these people to Orlando and you do a thing there, it was be cool. Well, then all the rest of these other pictures are in 19. I can't remember what the hurricane was in 19, but it was going to hit Palm Beach and ended up moving up the East Coast. And so they pulled me down again and said, hey, come help with evacuation. It's going to come out. And I ended up going, then I got called at 4 in the morning and said, hey, we're going to evacuate out of Georgia. So I went to Georgia and we took about 110 patients to Atlanta. And honestly, not a whole lot of staff could go to Atlanta, right? And so we're there that night unloading, and I can hear the chatter on the floors. And they're not happy because you have 110 new patients and probably not near as many staff that would normally come with them. And so I went down the next morning to the managers meeting. I said, look, we're going to have an issue if we don't figure out how to get these folks aligned. And I said, so we're going to take a line from, remember the Titans, love them, Titans. Remember when they went to the practice and they're all up there and nobody's talking to each other. And Denzel Washington says, we're going to do 3 a days until you come to me and you tell me something about somebody of a different race, and you tell me something about them or their family. So what we did was I said, we're going to provide meals to everybody while we're here. But the cost of admission for the meal is they have to take a selfie with somebody from the other building. And we're like, all right, whatever. So we called lunch the first day. And I'm sitting down in there and said, hey, lunch is here. Come in. And this lady comes in with a lovely little smile on her face. And she's like, yeah, I'm here for lunch and blah, blah, blah. And I get my phone out and I look and I say, well, I don't see your selfie. And she said, you were serious about that? I said, yes, ma'am. I gotta have a selfie. So she walks out. About 2 minutes later, the phone dings and a selfie shows up. She's coming in with her arm around somebody from the other building. And that the next 2 to 3 days, my phone gets burnt up of these people taking selfies of each other. The point of it is, even in the most dire of circumstances, when you can create community and you can connect people with each other, that was more fun than you can shake a stick at. And this, I love this lady here with this hat or turban thing on. Forgive me for not knowing exactly what that is called. But that first day, very polite lady, she said, that's a stupid idea. She didn't say it that way. She said it very politely and respectfully. And it was funny the way she said it. But by the end of it, these are only some of the pictures with her. She came from the other building and everybody wanted a picture with her because she's just a classy lady. So at the end of it, she said, that's a pretty good idea. So you could take any circumstance that is a mess and we can zero in on the problem, or we can say, how do we deal with this problem? So it's broaden and build. That's the point. The teamwork, it ended up being a whole lot of fun. I mean, not like I want to go and do that again, but it was fun. So here's the guarantee. I told you I'd give you a guarantee. So here's the guarantee. The one in the middle, that's my daughter. This is my family. And the one in the middle is the oldest daughter, the one biting her daughter's foot. And so when she was 14, she was doing like a lot of 14-year-olds playing her mom and I against each other. And the name of my company, Tresane, actually comes from the 4 values that came together when she was 14. And so, like a lot of people, she would say things like, hey, why can't I do that? Why can't, so-and-so can do this? Why can't this? Why can't that? And all those questions. Say, look, sweetie, there's no manual on how to be a parent. I'm trying to do the best I can with what I know, right? And so the guarantee is, don't try to be perfect and don't try to be something that you're not. Do what you have with what you know at the time, aligning with your values and what's important to you. And the guarantee is that you'll be more peaceful and the burnout will reduce. It's just, you can't control the world. And so the point is to let go of things you just can't control. That's the guarantee. And I'm going to share this last slide, which I really love. So if those of you that are good in math, you know that 704 out of 11,174 is 59.97%. And what is that? Well, that's Scotty Scheffler's driving accuracy. And so you may or may not know who Scotty Scheffler is. He was the first place golfer in the 2022 season that just finished. And so he was number 100th out of PGA players in driving accuracy. So from the tee box to the fairway. But he was the number one golfer, 4 wins in 22 with 16 million. So what's the point of this is that life and leadership, there's hazards and fairways, greens and whatever. And so sometimes we're going to have unintended consequences. It's not what happens with that. It's how do you think, all right, how did I get into this sand trap and what am I going to do to get out of it? How did I miss this fairway? How did I get behind this tree and what am I going to do to get out of it? And that's the point of Scotty Scheffler. So he was, 100th in driving accuracy, but you have a plan. You have to have an idea of the hazards and what's going on, take action, reflect and learn, and then repeat. And then you may or may not know who Ryan Ulmer is. Ryan Ulmer was the number 1 golfer in 2022 with driving accuracy. So he had 75% or something like that. But he made 400 grand compared to Scotty Scheffler's 16 million. So it's not about perfection. It's about what do you do when you know what's in front of you and how do you get over it. So that's it. There's a QR code if you want to learn more about leadership and team alignment. That's kind of what I like doing. I like doing that with Kelly and Jan and some folks. So I appreciate your time. I hope I finished up on time, Kristen.
Yeah, you did great. We do have a couple minutes. If there's any questions, you can put that into the chat box. And of course, we will be sharing David's presentation, the recording, and the handouts will be posted to our website shortly. So I thought really good insight, David. I feel like, one of the ways we're most successful here as FHCA is when we have flexibility and we don't operate in silos and everyone kind of understands how to work together. Even if you're not in the quality department and you're in communications, there's a way you're supporting that role in some respect. So really good information that you shared. So with that, I will wrap us up. Thank you again to David for presenting. Again, we are going to have this posted to our website shortly and look forward to hearing David and Kelly speaking at our annual conference. I do have one quick plug for those on. We're still looking for nominations for the Long-Term Care Achievement Awards that we give out at annual conference. So someone who's amazing, a resident, volunteers, nursing home or assisted living facility administrator, please nominate them. Those are due on Friday, and we're definitely looking for people to submit those. So with that, I hope everyone has a great day, and thanks again for participating.
Thank you.
Bye-bye.